So hello everyone, welcome to the class of civics today. Today I'll be taking the very second chapter of class 7, that is the role of government in health. So that is the chapter that I'm going to deal with it today, and I'm going to explain the important points so you can just take down the notes of it, and so that when you revisit the chapter you can revise from that. So in the meantime, before I share my screen, you just have to do the same thing. You need to take out your notebooks and take note of important points. Okay, so as you can see my screen, it's very clear that today we are going to discuss about the role of the government in health. So let us move on to this next slide. First, let us understand the meaning of health. Actually, you already know, children, that health refers to an ability of an individual to remain free from illness and injuries. But do you exactly feel like the same thing that we are talking about today? Definitely not. Health is something that is beyond remaining fit and injuries. Like a lot of factors which contribute in being free from illness and injuries. So health has a different meaning to it, right? Rather, we should take care of the following things in order to remain free from all those diseases and injuries. So let us look some of the broader perspective of it. So everybody knows that health is not only about disease, it is far beyond the things like other than disease, there are other factors which affect our health, like clean drinking water is one of the most important factors that contribute in the health of the person. Then we have proper nutritious food. Then we have uh, clean pollution free environment also contributes in the health of an individual. So if when we look to the examples that are stated on the screen, we can see that clean drinking water, proper nutritious food is somewhere responsible for making us free from illness or like any disease, because you know that when our immune system is not so strong and we are not able to combat with a particular disease, then likely we are likely we are going to fall ill. So that is why, in order to remain disease free, in order to remain healthy, we must focus on the two things that we need to be very judicious, and it is very important rather to care about the nutrition intake of us, so that our immune system can be built up in that way. On the other hand, water plays a major role. You already know that water is one of the most important factor which contributes in the human body, and definitely it is just and you know that clean water is necessary for our health, right? So let us move on to the next slide. Children, do you know that we have already talked about so many things, like we have read about Hakim Sheikh's story or so many things that are responsible for that. So let us understand that how many types of health care are there in the country which is serving presently. So particularly there are two kinds of health care. Let us see example wise. It is the first one that we are looking up to is a private healthcare center, whereas on the other hand, the second one that we are going to talk about is a public healthcare facility or a center, we can say. So private is basically what? Something like, for example, there are so many hospitals which are not owned by government, but rather they are owned and operated by an individual. Suppose if I own a hospital, then definitely that's my property, and that's not a government property. So everything that is in that includes the investment, the money of an individual or a person, we consider them as private, right? On the other hand, what is public? Public is, as the term itself suggests, that it is for everyone. Anyone can use it. On the other hand, it is definitely, when we are associated with the term public, we often consider government property with it, because you know that the government is responsible for the welfare of people, and that is why when we talk about the public healthcare, these are owned and operated by the government, right? So basically you already know that when we talk about the government hospitals, or when we talk about the primary healthcare centers, or private healthcare centers, these are entirely two different concepts but serving the same purpose. Both of the healthcare rather wishes for the welfare of the people who are, or patients who are coming into the hospitals. On the other hand, when we talk about a government property and a private property, for example, if we compare, if somebody goes to a hospital like Galaxy or Apollo, and somebody goes to BHU, definitely you will find a lot of difference with it, right? Because you know that when you are going to Galaxy, you might find that it is centrally air conditioned. Then when you're going to BHU, you might find that the hospital might be their fans are not working properly, no proper infrastructure is there, facilities there. So likewise the things can happen. So when you invest more money, you get more of facility. When you invest less money, you often are likely to receive less less fast service, plus as well as you're not able to get the proper facilities. So let us so that is what we, even you already know that what are the things that often contradict with one another. So let us understand the differences between public and private healthcare center. Okay, so see, children, you can see that this is a chart which is telling us the differences between it. So we have very well understood that what is the meaning of public healthcare, what is the meaning of private healthcare. So the first topic is very clear. It is owned and operated by government, and private healthcares are owned and operated by an individual, right? For example, you can see, you know that whenever you go to public healthcare, for example, when you go to government hospitals, you often find it very affordable and economical. For example, you went there and you want to consult to a doctor, and the consultation fee is, for example, it is 20 rupees, whereas when you're going to a private healthcare center and when you want a consultation of the doctor, then at that point of time you need to pay rupees 1200. So you find the difference between the amount that is charged in the two healthcare. Public healthcare was charging only 20, might be the rate differentiate, but not beyond a certain limit. But private healthcare, you may find that it is charging, it is too much of it is too much expensive, because it is charging a lot of money. Okay, so basically you already know, since we are talking about the government hospitals and government is actually contributing in the welfare of the people. So basically the public healthcare centers are often running for the welfare of the people, whereas the private healthcare or the hospitals are responsible for earning profit and definitely rendering services. On the other hand, when we talk about the public healthcare center, you might see that in a public healthcare center, it might take a long time to reach to the doctor. But when you take appointment from a private healthcare, or when you go for a treatment in private healthcare, they are giving you or offering you quick service and a better service, right? On the other hand, you can see that oftenly these public healthcare center, from where do they get money for arrangement of everything? It is actually funded by the government, right? It can be central, it can be state. On the other hand, when we are talking about the hospitals uh, of private healthcare, there, yes, definitely it is funded by the owner of that particular hospital. Okay, so I hope this was clear to all of you. My question is, I hope that my question was that who is the health minister of India? You can answer me in the comment section. And thank you so much for being one of